My name is Laura Bird, and I'm with the National Congress of American Indians. I am a legislative associate, and I want to thank you for joining us on today's webinar titled Overview of the Federal Employees Health Benefits Program. This webinar will be recorded and will be presented by Meredith Hensley and Jenny Mosian, who are with the U.S. Office of Personnel Management, otherwise known as OPM. This webinar is brought to you through the National Indian Health Outreach and Education Initiative, also known as NEHO, which is a partnership between NCAI, NIHB, and NCUI. After Meredith and Jenny present the slides to you, excuse me, you will have an opportunity to ask questions at the end of the presentation. Right now, I will have Brent Huggins introduce himself and explain how the webinar works. Brent?
Good afternoon, everyone. My name is Brent Huggins, and I'm a citizen of the Cherokee Nation and a Wilma Mankiller Fellow at NCAI, and I'll be one of the moderators for today's webinar. Before we begin the presentation, I'd like to go over some of the webinar features. First, you should see on your screen the PowerPoint for today's presentation. If during the presentation you experience any lag in slide transition, it may be a result of internet connection, so just give it a few seconds to update on your screen. Currently, with the exception of panelists, all audience phone lines are muted until the conclusion of the presentation. But if you'd like to ask a question, all audience, you can type in the question box on your webinar control panel. After the presentation, you will have a Q&A session, and panelists will answer the questions submitted through the question box. Also, your webinar, if you would like to ask your question over the phone, please use the raise the hand option so we can unmute your phone line after the presentation. And we will also be having questions at the end. So now I'd like to turn it over to Meredith, who can begin the presentation.
You can go ahead to the next slide. Good afternoon, everyone. My name is Meredith Hensley, and I'm Demi Mosian. We're program analysts from the U.S. Office of Personnel Management in Washington, D.C. One of the main functions of the Office of Personnel Management is to provide benefits to government employees, including health insurance through the Federal Employees Health Benefits Program, or FEHB. It's a pleasure to be here with you today to talk about the initiative to grant tribal employees health insurance under the FEHB. As Brent said, there'll be a question and answer session at the end of the presentation, and if you'd like to ask a question, just send it through the chat box at any time during the presentation, and we'll get to those at the end. Next slide. The purpose of this presentation is to provide you with an overview of the FEHB program and why it might be a good fit for your organization. For example, what are some of the features of the FEHB program, what benefits and plan types are available, who's eligible to enroll, what are some of the cost considerations, and how easy it is to administer and join the FEHB program. Next slide. In this section, we will discuss the hallmarks of the FEHB program and how tribal employers are eligible to participate. Next slide. First, let's talk about the background of the FEHB program. It became effective in 1960, so that means we have over 50 years of administering health benefits for employees. It's the largest employer-sponsored group health insurance program in the world, and the FEHB program offers a wide variety of plans and coverage to help you meet your health care needs, and we'll discuss those choices today. The FEHB program covers over 8.2 million people, including federal employees, retirees, and their families, and also tribal employees. This equates to a very large risk pool, which helps keep premiums stable, and we'll speak about that in a little bit. And it also provides over $47 billion in healthcare benefits annually. The FEHB program is open to every eligible employee, regardless of health status. Next slide. This program is governed by laws and regulations. The law establishing this program, which is found in Title V of the United States Code, Chapter 89, gives OPM the legal responsibility to administer the FEHB program. OPM also issues regulations to implement the law as Part 890 of Title V Code of Federal Regulations. Section 10221 of the Affordable Care Act extends the right to tribal employers to participate in the FEHB program, and this was added as part of the Affordable Care Act. The Affordable Care Act, this piece of it, entitles certain tribal employers to purchase the coverage, rights, and benefits of the FEHB program for their employees who are carrying out programs under either of the following acts. There would be urban Indian organizations carrying out programs under Title V of the Indian Healthcare Improvement Act, or tribes and tribal organizations carrying out programs under the Indian Self-Determination and Education Assistance Act. Next slide. Sorry, next slide. Okay. Oh, one back? Okay, perfect. A signature feature of the FEHB program is that every employee has the opportunity to choose the plan that best suits his or her individual needs. In our program, there are 97 available plans, and all of our plans provide comprehensive health benefits. Tribal employees are treated by the plans just like federal employees. They have access to the same plan choices and the same enrollment types as federal employees. Not every plan is available to every employee. For instance, our health maintenance organizations, or HMOs, only provide coverage in certain geographic or service areas, so the enrollment is limited to employees living or working in those locations. But on average, each person will have at least 15 choices. The health plans contract with doctors, hospitals, and other healthcare providers to form provider networks. When selecting your healthcare practitioner, your use of preferred providers will help reduce your out-of-pocket expenses. And if a person disagrees with the plan's decision about their claim, the FEHB program provides for an appeal process, otherwise known as disputed claims process. And also, each plan has a maximum amount of certain covered charges you have to pay out of your pocket during each year. This is the catastrophic maximum. Setting this maximum amount protects you. For example, if a plan's out-of-pocket limit for the year is $2,000, once you reach that, your covered benefits will be paid for by the plan for the remainder of the year. Next slide. We also offer options when FEHB coverage ends, for instance, if an employee leaves service. Most employees are eligible for one or more of the following options when their FEHB coverage ends. All FEHB plans extend benefits for 31 days when the coverage ends, except for when employees voluntarily cancel their health insurance, and there's no premium charge for this extension of benefits. When a tribal employee is no longer employed, the former tribal employee may enroll in any available FEHB plan under temporary continuation of coverage. Temporary continuation of coverage, or TCC, is similar to COBRA. TCC enrollees pay the entire premium plus a 2% administrative charge. And usually at the end of FEHB coverage, a member may convert to an individual policy with their health plan in which the benefits and rates are different. Next slide. The FEHB program emphasizes health and wellness. Plans are expected to offer general health and wellness programs, and many offer incentives for participating in these programs. They may offer disease management programs for conditions such as asthma and diabetes that emphasize prevention and maintenance. And if you adhere to your treatment plan and take your medication correctly, plans may offer incentives for your hard work and dedication. Plans provide programs to assist participants with weight management, quitting tobacco use, and for completing health risk assessments. Next slide. The FEHB program has mental health and substance abuse parity. What that means is coverage for planned mental health, substance abuse, medical, surgical, and hospital providers will have the same cost sharing as other medical benefits such as deductibles, coinsurance, and copays. And just like with other medical benefits, you have a preferred provider organization to reduce your out-of-pocket costs for generally accepted treatments. Next. Along with providing comprehensive health benefits, all FEHB plans offer coverage to help people quit using tobacco and like smoking. Plans offer 100% coverage for the following. 4 tobacco cessation counseling sessions are provided for no cost for at least 2 quit attempts per year, and all FDA-approved tobacco cessation medications are free with a doctor's prescription. And anyone covered under the FEHB program, including covered family members, can take advantage of this benefit, as well as the wellness benefits I mentioned earlier. And now Demi's going to talk about the different types of health plans that are available in the FEHB program. Next slide. So earlier, Meredith mentioned that the hallmark of the FEHB program is choice of health plan. There are a lot of health plans to choose from, but we also have 4 different types of health plans to choose from. These different types include your fee-for-service plan, health maintenance organizations or HMOs, consumer-driven health plans or CDHPs, and your high-deductible health plan. All of the plans offer preventive services at no cost when received from the preferred provider. We'll discuss the different types of plans now, but later, if you want more information, we just want you to know that you can find more information on our website at www.opm.gov/FEH-brochures. Then click on Plan Types on the left side of the screen. Next slide. Okay, let's start with our fee-for-service plans. These are our most traditional type of insurance plan. In the fee-for-service plan, the doctors and other providers receive a fee for each service. The plan will usually pay the provider directly, and that's when you stay in the network, or they will reimburse the member for covered services after the member has paid the bill and filed the claim. Usually that happens when a member goes out of network. All of our fee-for-service plans offer nationwide and international coverage. And again, they all have a network of preferred providers or a PPO. Generally, if a member wants to keep their out-of-pocket costs down, they should stay in the network. Next slide. Our next type is a health maintenance organization or HMO. And of course, these types of plans provide managed care through a network of physicians and hospitals in a particular geographic location. An HMO coordinates healthcare services to help make sure members get the care they need, and there's usually little to no paperwork for members to complete. As I said before, HMOs plans are based on a geographic location. So in order for a member to be eligible to enroll in an HMO, they must live or work in the HMO service area. If the enrollee or a covered family member moves out of the HMO service area or their job location changes, the enrollee can change to another plan without waiting during our annual open season, and we'll talk more about that later. So generally, members will only receive coverage when they use in-network providers when they're in an HMO, except in an emergency, of course, and members must get a referral to see a specialist. Next slide. Okay, our third type of plan is a consumer-driven health plan, or CDHP. This type of plan uses innovative approaches to help enrollees control their health care costs. When an employee enrolls into CDHP, the plan will set up a health fund to a certain dollar amount. The member can use this health fund to pay for qualified medical expenses, and when they use up the fund, they will need to pay a deductible. Once they've paid the deductible, then the plan will act like a traditional health plan. If the member does not use up their health fund during the year, it can roll over to the next year, up to a maximum amount of $5,000 for a self-only enrollment and $10,000 for a self and family enrollment, as long as the enrollee stays enrolled in the same plan. This makes a consumer-driven health plan a good choice for members whose annual health care expenses cost less than the amount of the health fund. Next slide. Our next type of plan, or final type of plan, is the high deductible health plan, or HDHP. The main feature of an HDHP, of course, is the high deductible. But another key feature is that when you enroll in a high deductible health plan, your plan will set up a health savings account, or an HSA. As long as the member is eligible, the plan will create this account, and a part of the member's premium will pass through into the HSA account each month. The member can also make deposits into the health savings account up to the IRS maximum amount. The money in this account earns interest, and the member can make tax-free withdrawals of these funds to pay for qualified out-of-pocket medical expenses. Plus, the health savings account is portable, so the member can take these funds with him or her if she changes health plans. This is why the high deductible health plan with the health savings account is a great way to save for future medical expenses. However, not everyone qualifies for HSA. Qualifications are based on IRS requirements. So if someone is not eligible for an HSA, they can still enroll in an HDHP, but instead the plan will set up an account called a Health Reimbursement Arrangement, or HRA. This type of fund, in this type of fund, the member cannot make separate deposits, and it doesn't earn interest. It's also not portable to another health plan. Basically, the HRA is similar to the fund you have in a CDHP. In either case, whether you have an HSA or an HRA, once you've used up your fund, the member will need to pay their high deductible, and then after that, the plan will pay like a traditional health plan. If you want more information about HDHPs and health savings accounts, you can also go to our website at www.opm.gov/FEHB brochures, and then you'll click on Health Savings Account on the left side of the screen. Next slide. So we have a lot of plans to choose from. So how will your employees decide which plan they should enroll in? Well, we have several tools that they can use. One is our OPM plan comparison tool. To use this tool, the enrollee will enter their zip code. They'll get a list of all the plans available in their area, and they can select up to 4 plans at a time to compare side by side. This tool also connects users to plan brochures, and by the way, the plan brochure is the official statement of benefits between OPM and the plans. It'll show them the benefit and premium information, consumer satisfaction survey results, and accreditation reviews. In another area of our website, a member can click on their state, and they can see the plans available in their state. They can click on the plan brochures and download them from there. By clicking on the brochure, they can get the comprehensive benefit details. They can visit the plan's websites. They can visit the plan's provider directories. They can see how plans' benefits change from one year to the next and read explanations of the plan's patient safety initiatives. Another tool we have is, it's a book. It's called the FEHB Guide for Tribal Employees. We print one every year, and this booklet includes summary information about the FEHB program, lists the plans in all the states. It'll show their premiums, selected benefits, consumer satisfaction survey results, and show where to find other health plan quality indicators. This guide is available on our website in PDF form for your download. We also have a tool that is maintained by an outside vendor called Plan Smart Choice. With this tool, a member will answer certain questions, and the tool will actually come up with some recommendations about which plan they should enroll in or may want to enroll in. Next slide. Okay, now we're going to switch gears to eligibility. we will discuss what makes your employees eligible to enroll in the FEHB program. Next slide. So your employees are eligible to enroll if they meet the IRS definition of a common law employee. They have to meet that definition as well as certain FEHB requirements for position type. There are a few types of employees that are not eligible to enroll in the FEHB. These ineligible types of employees include contract employees, intermittent employees, which are those who do not have a regular work schedule and work on an as-needed basis, certain temporary employees, and volunteers. Also, tribal retirees are not eligible to enroll in the FEHB program, as there was no provision in the law to extend benefits to tribal retirees. Next slide. So, all your common law employees are eligible if they are your full-time employees, your part-time employees, your seasonal employees, as long as the seasonal employees are expected to work for 6 months or more, and your term employees as long as their term appointment is for at least 1 year. All of these types are eligible as long as they meet the common law standard and are not one of the excluded position types mentioned earlier. Next slide. Okay, so now let's talk about the employee's family members. Which family members are eligible to be covered by the employee's self and family enrollment? Well, those family members include the employee's spouse and all of their children under age 26. If a tribal employee enrolls in a self and family enrollment, they must enter all of their family members on our health benefits election form, which we call the SF-2809, and they'll need to notify the health plan directly if a family member loses eligibility, for example, one of their children reaches age 26, or if they acquire a new family member. So let's talk about spouses. The spouse of a tribal employee is an eligible family member as long as their marriage is legally valid. Is a legally valid marriage, including tribal marriages, valid common law marriages, in states where marriages are recognized. All of their children under 26 are covered under their parent self and family enrollment, even if they are married, adopted, recognized natural children, foster children who meet certain requirements, stepchildren, including children of same-sex domestic partners, and children who are 26 and over who have been deemed incapable of self-support due to a disability that existed before age 26. And again, all family members are automatically covered under a tribal employee's self and family FEHB enrollment and cannot be removed. Next slide. Okay, now we're going to talk about FEHB enrollment and the enrollment types. Next slide. In the FEHB program, currently we have two types of enrollment. We have a self-only enrollment and a self and family enrollment. A self-only enrollment provides benefits for only the enrollee or tribal employee. A self and family FEHB enrollment provides benefits for the employee and, again, all of their eligible family members, which includes spouse and all of their children under age 26. Next slide. Now, you probably heard about the Bipartisan Budget Act of 2013. This allows a self-plus-one enrollment type in the FEHB program. Employees may begin enrolling in self-plus-one during the 2015 open season period for an effective date of January 1, 2016. So the self-plus-one is not going to be available until 2016. OPM will be issuing guidance at a later date. Next slide. Now let's discuss when your tribal employees can enroll in the FEHB program. The first opportunity is during a tribal employer's initial enrollment opportunity. This period is when the tribal employer begins participation in the FEHB program and offers it to its eligible tribal employees for the first time. That's the first time an employee can enroll. The next time is once a tribal employer has been participating, the tribal employer will offer coverage to all new or newly eligible employees. A new or newly eligible employee has 60 days to decide to enroll in the FEHB program. The third time an employee can enroll is during our annual open season. The annual open season runs from mid-November through mid-December. Another time an employee can enroll is when they experience certain qualifying life events, such as the birth of a child, marriage, or if you lose your other health coverage. Next slide. So let's talk more about the annual open season. I mentioned that this is an opportunity to enroll in a health plan, but it's also when you can cancel your coverage, change health plans options, or change the enrollment type, like from self-only to self and family or vice versa. If an employee takes no action during the open season, their current FEHB enrollment will continue automatically for the next year, and he or she will be subject to any changes in the plan's premiums and benefits. Open season occurs annually, as I mentioned before, from mid-November to mid-December. And prior to open season, OPM issues each year some letters called Tribal Benefits Administration Letters. These letters provide specific instructions on the coordination of open season and lets tribal employers know of any changes in materials to be issued or procedures to be followed during that period. All of our open season tribal benefits administration letters are available on our website, and the link is on the slide. Next slide. Okay. So now we're going to discuss some cost considerations, including information on the tribal employer and tribal employee shares of the FEHB premium. Next slide. Some advantages to the FEHB program are that OPM takes on the role of what a broker will provide you without any cost to you. Therefore, there are no broker fees. There's also no age banding in the FEHB program. Employee premiums are standardized. OPM sets the rates annually, and they're published on our website along with our educational materials. FEHB premiums are also stable, which I've mentioned before, and I'll give an illustration on the next slide. We've also heard from many participating tribes in the FEHB program, tribes and tribal organizations, that participating in the FEHB program immediately had a significant and positive effect on their services through reimbursements to IHS facilities, which have allowed them to expand and improve their services that they provide through the IHS facilities. Next slide. As you can see from this slide, and we mentioned before, an advantage of our large enrolled population is that the premiums tend to remain relatively stable over time. As you can see from the past 4 years, our premium increases have ranged from 3.4% to 3.8%. This is the overall weighted average, so it takes into account all plans participating in the program, and they tend to remain fairly stable over time. Next slide. OPM administers the contracts for FEHB plans, including negotiating the benefits and rates that each plan will offer. So we take that off your plate as well. We calculate both the government share and the employee share of the FEHB premiums, and the premiums can be found on our website, www.opm.gov/tribal programs. And both the tribal employer and the tribal employee share the cost of the premium. When we say government contribution, we're indicating that the tribal employer pays that. The federal government does not contribute to the premium cost. Next slide. The tribal employer premium contribution must equal the amount of the government contribution, as I said, and OPM calculates that each year for you. And the government contribution is what the tribal employer pays towards premiums, and it's about 72 to 75% of the average FEHB premiums. But a difference between regular federal government FEHB and tribal employer FEHB, that a tribal employer may contribute more than the amount of the government contribution, up to 100%. So if you wanted to pay, as an employee, you wanted to pay more towards your employees' premiums, you can do so up to 100% of the premium. Next slide. Now we're going to talk about all of the tools and resources that are provided to you to facilitate administering the Federal Employees Health Benefits Program. Next slide. OPM collaborated with the National Finance Center, which is part of the USDA, to build the Tribal Insurance Processing System, or what we call TIPS. TIPS is an online enrollment and billing portal. It collects and transmits enrollment data to the health plans that HR and benefits personnel enter into the system. And the National Finance Center also collects and transmits premium payments through an automated system called PADS, or pre-authorized debit system. So as long as you have your bank account linked to your enrollment system, that comes out automatically each month. Next slide. We've talked a lot about what OPM does, but I just want to speak specifically about what the OPM Tribal Desk does. We have a dedicated staff on the Tribal Desk to assist with any FEHB-related questions. For instance, when you join the FEHB, you're assigned a liaison which guides you through your initial enrollment and beyond. We also handle the administration of contracts for the FEHB plans, which includes negotiating a contract with each plan, the benefits and rates that each plan will offer. We also monitor plan performance through customer satisfaction surveys, fraud and abuse data, and OPM produces informational materials to help your employees make a more informed decision when choosing a health plan. And Demi mentioned some of these earlier. But we have quick guides, we have answers to common questions, or FAQs. We also have videos such as what plan type is right for you. We have training presentation, health benefit election forms and guidance, and a human resource handbook for benefits personnel on our website to help you administer the FEHB program with ease. Next slide. Okay. We provide a wealth of resources for you and your employees on our website, www.opm.gov/tribal-programs, including the Tribal FEHB Handbook, which is the handbook for your benefits and human resource personnel. We have the frequently asked questions. We have other HR personnel resources to help with day-to-day operations. We have an enrollment and eligibility guidance, benefits, premium information, health plan brochures, and much, much more. We really encourage you to check out our website, www.opm.gov/tribal-programs. Next slide. May 2014 marks the second-year anniversary of FEHB being available to tribes, urban Indian organizations, and tribal organizations. Here's a quick update on how the program has grown. Currently, we have 62 participating tribes, tribal organizations, and urban Indian organizations. And there are over 11,000 tribal employees currently enrolled with over 20,000 covered lives. Next slide. These 62 tribes and tribal organizations are participating in the FEHB are from 17 states. However, the main concentration of enrollees are in Mississippi, Alaska, California, Maine, Missouri, and Oklahoma. If you'd like to learn more about the FEHB program, in addition to speaking with us and checking out our website, you also might want to see if there are tribal organizations in your geographic area that are participating in FEHB, so you can get a first-hand account of their experiences. And now Demi's going to talk to you a little bit about how you can join the FEHB program. Okay, well hopefully at this point you're wondering how your tribe or tribal organization can participate. It's pretty simple. Next slide. First, you just need to get in touch with us. We prefer you get in touch with us at least 3 months before your desired effective date. You can call us at 202-606-2530, or you can email us at tribalprograms@opm.gov. Once you get in touch with us, we will send you back a form called the Expressed Interest Fact Sheet. It's a one-page form and just requests some demographic information back from you. And we'll also request that you send us a copy of your grant, contract, compact, or whatever you have that shows that you are eligible to participate. Then we'll confirm your eligibility. By sending us the Expressed Interest Fact Sheet, you will not be committing yourself to participating. You can still choose not to. After you send us the Expressed Interest Fact Sheet, we will send you the agreement to participate and the application packet. You'll need to complete that packet and sign the agreement and send that back to us once you've decided that you will be participating. That's when you commit. We'll need to have that back from you exactly 2 months before your desired effective date or earlier. For example, if you wanted to start on January 1, 2015, we will need your signed agreement and application packet by November 1st. Next slide. Meredith already mentioned a lot of our resources, but we'll just go over it one more time. We have our website. There's lots of information on there, www.opm.gov/tribalprograms. You also may want to request to join our Tribal Programs listserv. We use this listserv to send out FEHB program updates and also training opportunities. We also have our Tribal Desk, and that's our email address is tribalprograms@opm.gov. And again, the phone number is 202-606-2530. Next slide. I mentioned training a second ago, and we would like to announce that we are hosting an FEHB program training in Anchorage, Alaska on June 12th. So we will be providing comprehensive training at this event. And it will include FEHB 101, eligibility, enrollment, forms guidance, premiums, and more. We'll also give comprehensive training on the Tribal Insurance Processing System, or TIPS. And as Meredith mentioned, this is the online enrollment portal for the tribes. The tribes use this portal to manage enrollments and billing. This training is open to anyone that would like to learn more about the FEHB program, and the target audience of the training is human resources personnel and benefits specialists. So if you would like more information or to attend the June 12th training, please send us an email at tribalprograms@opm.gov by this Friday, May 30th. Please include your name, job title, employer, and an approximate number of employees in your organization. Next slide. We just want to thank you for tuning in today. We hope you found the presentation to be useful and informative. We welcome your input on how we may improve the information and we provide, and you can email us any comments or suggestions to tribalprograms@opm.gov. Also, if you have any really specific questions in relation to your organization, feel free to contact us as well. And now we're happy to take any questions you have about the program at this time.
Thank you, Meredith and Jenny. Brent, do we have any questions?
I don't see any questions in the chat box. Again, I'd like to remind everyone that there should be a question box, most likely on your right-hand screen, where you can type in a question, and then I can read it to Meredith. Okay, we are getting a couple of questions. So the first question is just asking when the slideshow might be available.
Laura, do you want to take that one?
Sure. After this presentation, we have everyone's email address who registered for this webinar. Brent Huggins will be emailing out the slides so that all of you will have them.
Okay, and now we have a question. Is it possible for tribes to pay 100% for tribal member employees but pay less than 100% for non-tribal member employees?
No, that's not possible. There are ways to, a lot of organizations that are participating will pay, or at least some of the organizations will pay 100% of self-only, for instance, and then they'll pay the minimum government contribution for self and family. But you can't, when choosing to pay 100%, you can't discriminate between types of employee, whether that be a tribal member or a non-tribal member, or, like you can't pay 100% of your program analysts, but not your, hospitality employees. So you can pay different amount between enrollment type, but not employee type.
So we also have a question, will dental and vision coverage be available in the future?
Unfortunately, that program was not included in the Affordable Care Act, so we don't have any, it won't be available as far as we know. But yeah, it would basically take an amendment to the law, so if there are organizations that are really interested in having that be part of the law, we encourage you to write your congressman, to advocate with your health boards and other interested parties to possibly get that passed in the future. So it is possible, but it's not on the docket at this moment.
And the next question asks, do all employees qualify for the program, including casino employees, or is it just for government operations?
All of the employees of the tribe, as long as they meet that common law definition, which basically says the organization controls their schedule and the type of work they do, are eligible. So people in the casino or hospitality industry would be eligible.
And the next question asks, is there sponsorships for the training on June 12th in Alaska?
So we're not taking any sponsorship because this is just something we do to help people interested in the program and those administering the program to help learn about the actual administration. So it's free for people to attend. It's not like a big conference with sponsors. It's just something we do as part of our customer service.
And Laura, I think this is a question for you. I understand that the webinar will be displayed on your website. Is that correct?
It will be, yes. The webinar will be posted on tribalhealthcare.org, and we will email the slides to participants today.
And then the next question asks, could non-employee tribal members also be added to the program?
So you're saying you have tribal members who aren't working. So basically they have to work for the organization to be covered. Either that or they have to be an eligible family member under the enrollment. And I wanted to also say, I guess the question came up about the casino employees. The premiums, and a question came up about the premium payments. Premiums can be prorated, or they're actually prorated for part-time employees but who work between 16 and 32 hours at the time. So for part-time employees, you don't pay the entire government contribution.
And another question, is the one-day training in Anchorage, Alaska?
Yes, it's in Anchorage. And if people want to get more information about the, where and when and directions, that kind of thing, they can contact us at tribalprograms@opm.gov and let us know they want to attend, and we'll give them all that information then. Okay. Any other questions for us, Brent?
We might have one more question. From Anne. She was trying to ask it, I think, over the phone line, but she would need to put in her audio pin to unmute, to be able to unmute her. So if you're able to do that, it might be easier to type your question in the question box.
One, we also just want to reiterate, if they, have questions further down the line, or think of something later today or whenever, they can always email us at tribalprograms@opm.gov, and we'll get back to them personally.
And we also had a question saying part-time employees get prorated rates. Are the benefits prorated as well?
No, they receive the exact same benefits package. Anyone who enrolls in the program gets, the benefits as listed in the health plan brochure. So, and all of our health plans offer comprehensive health benefits, so no one gets shortchanged on the health benefits.
And someone's also asking, is there a possibility of the training being held in the central part of the country?
Well, we do, based on demand, we have trainings here in the Washington, D.C. office. We're also, the answer is it might be available. Yeah. The best thing to do is to send us an email and ask to be added to our listserv, so that if we can get something approved, you'll get the announcement. But the answer is we're hopefully going to be organizing some in different locations. I don't know about, in the middle of the country, perhaps California and possibly Nashville, Tennessee, but those aren't set in stone at this time.
Meredith and Jenny, just maybe we can talk offline about maybe collaborating on some regional training or two or something offline. Maybe we can talk about that. We'd love to do that.
That would be fantastic. Thanks, Laura.
Another question is, what are the total costs of the premiums, and how is this determined?
The total cost? Well, it depends on the health plan the person enrolls in. I mean, the actuaries calculate the rates each year based on a formula, and it's basically 72% of the program-wide weighted average. So the premiums are all different. It depends on which plan the person enrolls in. And we can help with cost estimate offline if they want to contact us. But basically, they can. One way we recommend is by taking the lowest premium available in that area. I believe it is a nationwide plan, and the most expensive, and doing sort of in between, and then estimating it by the number of self-only enrollments they would have and the number of self and family enrollments they may have. That might make sense to some people, but if it doesn't, we can help people through that. But there isn't, one bottom line number for, it's going to be different for each organization.
The next person asked, what is considered part-time for the organization to be eligible?
Well, the person has to have a regular schedule, and part-time is those who work between 16 to 32 hours. They receive the prorated. Right. But employees working 16 hours and below actually receive the full government contribution. So there isn't a number of hours that they have to work in order to be eligible. All part-time employees, as long as they're a common law employee with a regular schedule, are eligible to join. if you want to estimate how much you can prorate your part-time employees' premium, you can download the Tribal FEHB handbook that's on our website. There's the formulas on pages 17 and 18.
And what is a common law employee?
Well, you'll have to go to the IRS website to get the full definition. And if you need it, send us an email and we can send you back the link. But basically, the common law definition says that as the employer, you have the right to control what they do and how they do it. You may give them the freedom to act on their own, but the key is that you have the right to control those things. But that's just, the most basic definition. Again, you would really need to go on the IRS website to get the full definition. But in our handbook, and we also have in our FAQs, a lot of different places, we have information that will help tribal employers make the determination about who's eligible and who's not. And we're here for guidance.
And a follow-up to your answer is, what does it mean when the employee is less than 16? The government pays the premium. Employer does not pay the premium then?
No, unfortunately, even if the person works less than 16 hours and they are a regularly scheduled part-time employee, you still are responsible for paying the tribal employer contribution. It's just that those working less than 16 hours are entitled to the full government contribution. You can't prorate those, and that's just because of a quirk in the law. Brent, were they talking about age, like an age 16?
I think it's they're referencing the 16 hours.
Oh, okay. I thought you said age 16. So.
Oh, sorry, no. 16.
Oh, okay. And just to clarify, when I'm saying, or we are saying government contribution, we mean the tribal employer contribution.
Will the definition of part-time be reduced to less than 32 anytime soon? I thought it was going to be reduced to 30 hours.
Okay. So that's, I guess, an IRS definition for the Affordable Care Act, not the FEHB definition. Any changes that will be coming down the pipeline for the Affordable Care Act, our program will be completely in line with those changes. So you never have to worry about compliance. These are some great questions.
And it doesn't look like we have any more questions as of now.
All right. Well, again, if you have questions, feel free to contact us at tribalprograms@opm.gov or by telephone at 202-606-2530. You most likely, you might get Demi or myself, Meredith, but all of us, we're a small staff dedicated to the tribal programs, and we'll all be able to knowledgeably answer your questions and assist you however you might need it.
We had another question come in.
Okay.
When an employee requests dependent coverage, can they request to remove them anytime or wait until the annual open enrollment?
So if an employee has a self and family enrollment, they cannot remove any of their eligible family members from their enrollment. The only way to remove an eligible family member would be to change to a self-only enrollment. That includes children, spouses. So there is no legal mechanism to remove them from a self and family enrollment.
Great. Thank you, Meredith and Jetty. We're about up on the hour. It's almost 2 o'clock. Brent, do you have any final thing to say?
No, I don't think so. Just thank you for joining us.
Yes.
Thank you so much.
Yeah, thank you for joining us. We appreciate you presenting this webinar for us today. It was very helpful, and we really appreciated everyone's questions. Thank you so much.
Thank you very much.